It's like a double doctor, but it's a lot of emphasis on research, right? Publications, research, publications in medicine, and also treatment of disease pathologies and treatment. This is the focus of MD's philosophies. Now let's take a look at osteopathic medical schools. They have a different philosophies, and DOs actually started in 1874. Which was discovered by a doctor known as A.T. Steele, Dr. A.T. Steele. Now, Dr. A.T. Steele thought there's a different way we should approach medicine. Like I said, it's a different philosophy. And his idea is basically states that the mind, the body, and the soul, they're all connected. And if there's a dysfunction in the musculoskeletal system of the patient body, you should be able to use your hands to be able to fix this dysfunction. That was the theory, and that was the belief that Dr. A.T. Steele came up with, and that's why they call it osteopathic medicine. Now, just like I was confused when I was applying to medical school, when I heard the word osteo and pathic, I thought these were doctors that treated bones, right? It might sound confusing, right? You might think bones, pathology of bones, medicine. But that's not the true definition of osteopathic medicine. Osteopathic medical school focuses on primary care. Remember at the beginning, I was telling you about the 3 primary care specialties: family medicine, internal medicine, and pediatrics. So if you decide to apply to an osteopathic medical school, the difference is they're going to teach you how to use osteopathic manipulative medicine, OMT or OMM, osteopathic manipulation techniques. And these are actually techniques. For example, let's say a patient has lower back pain. They're going to train you on how to diagnose where there's a tender point. So you touch the patient's back like, oh, that hurts. And you said, oh, you know, what were you doing? Well, doc, I was twisting this way, and I twisted this way, and I kind of turned, and I couldn't move back again, and it hurts now. Well, there's 2 options to treating you. As an osteopathic doctor, I can just give you Motrin or ibuprofen, and that will take away the pain. But it's a mechanical problem. So in osteopathic medical schools, they teach you how to use your hands to diagnose where the problem is. They call it somatic dysfunction because your body's twisted in the wrong direction, and then teach you techniques of how to fix it back. So you put the patients back into their initial position, and this will help them heal better. But the good news is, as an osteopathic medical physician, you are licensed just the same way as an MD to be able to prescribe medications and perform surgeries. So if you're a surgeon, you will be able to actually, you can use your hands to treat the patient. If they need surgery, you said, oh, you're going to need surgery, we're going to have to take you to the operating table and actually probably do a discectomy or something like that, or laminectomy, whatever procedure the surgeon thinks is that it's needed. So the biggest difference when you decide to apply to a DO school is to know that you're going to learn how to use osteopathic manipulative medicine. And this involves treating the muscles, which is the musculoskeletal, the skeletal system, which involves also the bone system, ligaments, soft tissues, your fascia, and they teach you on how to treat a patient from head to toe. Every single part of the body can be manipulated in one shape, form, or the other to be able to fix any problem. And that is the basic difference between an MD school and a DO school. It's the philosophy. And also, aside from what you're going to be taught, which is the course that's different, you're also going to be taught in a different way of thinking. When you see a patient, you're going to approach them as a mind, body, spirit, just as the way you would treat your family member. Now, don't get me wrong, MD schools also teach how to approach the patient's care in the same way. But the difference is, if you have an MD doctor that finds a patient that has a musculoskeletal problem, because they do not have the proper training to be able to fix this, only a DO physician will be able to apply osteopathic manipulative medicine in that scenario only to be able to fix this problem. Okay? So that is the major difference between osteopathic medicine and also allopathic. That is the other word for MDs, is known as allopathic medicine or medical school. That is the major difference. Another major difference between an osteopathic or allopathic medical school is that we all take medical exam, licensing exam. So in order to be a physician in the United States, all three of these medical schools, you have to take either the United States Medical Licensing Exam, known as the USMLE, or the COMLEX, which is the Comprehensive Osteopathic Licensing Exam. So if you go to an allopathic medical school, you can take the USMLE Step 1, Step 2, and Step 3. You got to take 3 board exams. You take this first 2 in your medical school, and this is in your residency. If you go to an osteopathic medical school, we take the COMLEX Level 1, Level 2, and Level 3 exam. This exam are exactly equivalent. They're equivalent board exams, and IMGs also have to take the United States Medical Licensing Exam, Step 1, Step 2, and Step 3, in order for all of us to get into residency. The USMLE is different from the COMLEX in some variations, because on the COMLEX, they're going to test you on these OMM skills, and these OMT skills they taught you in osteopathic medical schools compared to allopathic medical schools. And there's also some variations in the different testing questions they ask you. But you don't have to worry about that as an applicant now. When you get there, you'll be able to learn the biggest difference between USMLE and COMLEX. And I also wrote a book on the differences and how to prepare for this board exam. However, there's a catch. As an osteopathic medical applicant, you can actually apply to an allopathic medical school. Can you imagine? That's awesome, right? You can actually apply to an MD residency. But if you're going to apply, you have to take the United States Medical Licensing Exam. So you're going to take your COMLEX Level 1 and take your USMLE Step 1. You can also take your USMLE Step 2. It's optional. You don't have to take it. And also you have to take the USMLE, the COMLEX Level 2, which means you have to take 4 board exams, especially if you want to go into ophthalmology, ENT, like ear, nose, and throat. Those are the other, ear, nose, and throat is another different kind of surgery. You want to go to high-end specialties, and because we have more residencies. So let's talk about residency difference. DO's residencies has all the residencies pretty much, except a few high-end specialties. And the only reason why DOs have a little bit less of the residencies I'm going to talk about is because they haven't been around long enough compared to allopathic residencies. So let's take a look at a few of them. There's very top-notch specialties like dermatology. We have dermatology DO residencies. But residencies such as anesthesia, there's very, very few DO residencies in anesthesiology. So let's say you went to a DO school and wanted to do anesthesiology. You're going to take your COMLEX Level 1 and Level 2, USMLE Step 1 and Step 2. You don't really have to take Step 2, but if you do take it, it's also beneficial if you do really well on it. And then you can apply to an allopathic residency in anesthesia. PM&R. We don't have a lot of PM&R residencies in DO's residencies, so when you apply to PM&R, it's mostly going to be an allopathic residency. So those are the things you have to remember when you're applying. But residencies such as ENT, right, general surgery, family medicine, internal medicine, pediatrics, right? You know, there's a lot of DO residencies pretty much in everything I've listed except CIS. And also, if you want to do a dermatology residency, There's dermatology residencies for DOs, but it's not as much as MD residency. So if you want to apply to both, you can apply to to the dermatology residency DOs and also apply to the one for the MD, so you can increase your chances of matching into residency. Okay? Now let's talk about fellowships. Remember I told you internal medicine doctor can specialize in cardiology, GI, right, endocrine. When it comes to fellowships, there's not a lot, right, of fellowships. There are fellowships. We have infectious disease cardiology fellowships for DOs, but the difference is there's not a lot of fellowships in the DO world compared to the MD world. Okay, but I'm pretty sure in the nearest future this is going to increase more as time goes on. But at the time when I'm making this video, I'm just letting you know in advance that if you want to do a fellowship, and your DOs, if you end up in an allopathic residency, you might have a chance of getting into their fellowships because they just have a lot more fellowships, a lot of fellowships. For example, Hem-Onc. Hem-Onc is hematology, oncology. There's not a lot of Hem-Onc DO residencies. So if you want to do you just love cancer patients, leukemia patients, and you really want to go into Hem-Onc, you really have to go into an allopathic residency for you to actually match into this kind of fellowship, to do a fellowship in hematology and oncology. And so if you go to a DO residency and you want to do a fellowship, you just have to apply to this, and you're a very strong applicant, you're going to be able to get into these fellowships. Okay? So let's take a look at international medical graduate for a minute. If you go to an international medical school, Caribbean, now there are advantages of going to these medical schools. Let's talk about some of them. Number one, you're going to graduate with your MD degree, and it's going to cost you less money. It's going to cost less because they're cheaper. However, you're also going to be a good doctor as long as you study very, very well. You have to take the Usmle exam just like an MD applicant. And then you have to come back to the United States to do your clinical rotations. Now, this is where the dilemma is. The disadvantage, because everything in life has advantages and disadvantages, the disadvantage of going to a Caribbean is you have to make sure whichever Caribbean medical school you're applying to actually has solid connections for clerkships, clinical rotations with hospitals in the United States, right? So you want to make sure after your first 2 years of basic medical sciences, you have somewhere to rotate, right? So you have a place to do your clinical rotations in your third and fourth year of medical school. So that's very important. If the school doesn't have it, that is not a good thing because you don't want to be hustling and looking for clinical rotations as a third or fourth year international medical student. Also, when it comes to the Usmle exam, it's very important that you understand that the way the matching works, and match just means how we get into residency in the United States. The way the matching process works is it's a ranking system. So if you go to the United States, U.S. residents and U.S. citizens are favored first before international medical graduates. So it's a rank order list. Let's say you apply to an allopathic residency as an MD student in an MD school in the United States. You're going to get the first shot, right? They're going to look at your application first. They want to take their students. If you're a DO and you apply to a DO residency, right? Basically, you're going to get your first shot and you're going to match. Now, the difference is MDs cannot apply to DO residencies, but DOs can apply to MD residency. Okay? So, in this case, it's going to be an allopathic graduate, osteopathic graduate, and then an international medical graduate. So you get the third option on the list. And also, your USMLE scores has to be very, very stellar. You have to do really, really well. So let's say you want to do internal medicine in the United States and you're coming from the international medical schools. You have to score at least in the 85th percentile starting. Right? You want to score at least an 85 on your boards when you take this exam, because your passing score, the passing score is 75, and right now it's like 189 is the passing score. You want to make sure you get at least a 200 or 205. Let's say you're applying to an internal medicine residence in the U.S., because your score has to be stronger, if not even better, than all the applicants that are applying to these medical schools. To these medical residencies. So that might be a disadvantage, because if you don't do well on your USMLE and you don't do well on your clinical rotations, your chances of matching is very, very low. Notwithstanding, a lot of people coming from international medical graduate schools do match into residency, so don't ever get discouraged. But I'm giving you the warning shot before you go down there to say to yourself, you know what? If I don't get into medical school in the United States, I try to get into an MD school, I get to get into DO school, I don't get in. I'm going to go and get my MD degree in the Caribbean. But I'm going to work hard. I'm going to work really, really, really hard, right? Study well. Do well and excel in medical school here. Get like the top-notch 99 percentile when I did my USMLE. When I do my clinical rotations, I'm going to shine. I'm going to do very well. Get strong letters of recommendation. Do research. Do whatever it takes to make me a better applicant. So when I apply for residencies, I will be able to match into the residencies of my choice. There's also a caveat. The very, very, very super competitive specialties like ENT, general surgery, dermatology, urology, ophthalmologists, those are very competitive residencies that only the top of the crop of medical school applicants actually get into. So if you wanted to get into, you're going to be an ophthalmologist, for example, you have to make sure that you're realistic, that you better be scoring the 240s and 250s when you take your USMLE, and also understand that your chances of matching into this residency is not as the same as students applying in the US. That is just a realistic goal. So if you really want to be an ophthalmologist, I would strongly advise you to stay in the US and get your degree, because if you go down to the Caribbean, then you just decrease your chances and your likelihood. I'm not saying you can't get it. I'm not saying it's impossible, because I don't believe anything is impossible, because everything is possible. But be honest and realistic with yourself and look at the statistic. Ask the medical school that you're applying for. I want to be an ophthalmologist. How many people have actually matched into ophthalmology in your medical school? It's a fair question. And they said, hey, listen, we've got 2 people from our program that's matching to ophthalmology in the United States coming from the Caribbean. You say, you know what? Yes. As long as somebody has done it, I'm going in. Or you can also say, if nobody else has been an ophthalmologist yet or a dermatologist coming from this medical school, I'm going to be the first one to do it. And then you do it. All right? But also be realistic and also plan accordingly ahead of time. That is just a caveat. That is just a caveat. Okay? So now that we've seen the differences between MD schools, DO schools, and IMGs, I have to say one more thing about what makes DO schools a little bit special. Right? So, although scientific research is not as much in DO schools compared to MD schools, DO schools still have faculty members that do research. Right? If you go to UMDNJ, the University of Medicine and Dentistry School of Osteopathic Medicine, we have a School of Graduate Medical Sciences which is purely dedicated to research. And one of our researchers just found, a testing for Alzheimer's disease, which is the latest research development in the finding disease pathology and processes and understanding how the disease works. So, although I did say the philosophy of an allopathic medical institution focuses on scientific research and data, and also, disease treatment and symptoms, understand that as a DO, you get to learn how to use scientific research, observations, publications, learn osteopathic manipulative medicine, you have a chance to take the USMLE if you want to go into an allopathic residency. And also the philosophy of treating the body, the mind, and the spirit is what makes an osteopathic medical doctor a well-rounded physician that understands when it's applicable to use any of these modalities, and you can do surgery and also prescribe medications. So, people might ask me, you're an emergency medicine physician, do you ever use OMT? Yes, I do. I actually use it. When my patients come into the quick check section of the emergency department and a patient is complaining of lower back pain, I treat them with OMT first. And then I write them a prescription like, all right, take this medicine and this should help. And use some ice patches and also use some rest to help the patient. Now what I've done is mechanically treat the patient, give them medications, so overall their chances of getting better is faster. Okay? And that is biggest difference. But I have to also emphasize that both MDs and DOs, right, all work together as the same healthcare team. We are one team. We work together to make our patient's life better. And that is the most important part of medicine, to be compassionate, to help your patients feel better, and to be a teacher, which means to be a doctor. And that's one of the most important aspects and tenets of medicine. So, you are the applicant. I have laid down the similarities, broken some of the myths that you've heard about MDs, DO schools, IMGs. I've given you all the options. Now you know what to do. Don't ever be discouraged when you apply to medical schools. My advice for you is have an open mind. Do your research. If you want to go to an MD school, go to an MD school. If you want to go to a DO school, go to a DO school. If you want to go to an international medical school, go to an international medical school. As long as you're going to be happy. Know your goals. What are you looking for in medicine? Why do you want to become a doctor is the most important question you have to ask yourself. If you can answer that question first, half of your work is done. And then your second step is to say, now that I know I want to be a doctor, what kind of doctor do I want to be? You've got 3 different pathways to become a physician in the United States. Now, the third thing is to do your research. Your research is to make sure what are the average MCAT scores, what are the requirements to get into this kind of school, and what are the requirements to get in this kind of school, and what are the requirements to get in this kind of school. And what do? You visit a few of these medical schools. You go through their affairs, right? You talk to them, you ask questions. And when you ask all the questions to all your answers, once you get your answers, you write it down on a piece of paper, you go to a DO school, and if you want to learn about osteopathic medicine, the only way you can learn about it is to see it yourselves. Visit your nearest osteopathic medical school and see what osteopathic manipulative medicine is all about. Now, there's another caveat. Students often say, oh, aren't DOs like chiropractors? No, absolutely not. DOs are not chiropractors. Now, some of the things chiropractors do treatment-wise might seem similar to some of the things you will learn in osteopathic manipulative medicine, but the biggest difference is to know that chiropractors only focus on the spine. That's all they treat. Now, when you go to all 3 medical schools, you're going to learn about biochemistry, physiology, anatomy, pharmacology, pathology. You're going to learn about biostatistics, prevention. You're going to learn about all these things, microbiology. You're going to learn about internal medicine, cardiology. They will teach you everything you need to know about medicine. In allopathic medical schools, they teach a lot of embryology, which is not taught in osteopathic medical schools. But in osteopathic medical school, we learn osteopathic manipulative medicine for the first 2 years of medical school. So that's another difference. But we all learn the same tenets, the same important core topics and subjects that an adequate medical doctor needs to understand. So you're a well-rounded physician that can treat a patient properly. So DOs are not chiropractors. Chiropractors are not DOs. DOs are licensed physicians, just like MDs, to be able to practice medicine and surgery in the United States. Also, just like international medical graduates that come from the Caribbean. So, on this note, do your research, do your homework. If you like the philosophy of an allopathic institution, go for it. Don't let anybody stop you, because you are the master of your own fate. You're the owner of your own destiny. Don't let anybody rewrite your own history. If you attend a DO school and you visit there and you see, I like this philosophy. I want to be a primary care doctor. For example, let's take a look. I have to give you one more statistic. So, if you visit a DO school, it's very important to note that out of 100% of DO physicians in the United States, 60% of doctors that graduate from osteopathic medical school go into primary care. And 40% go into specialties. When I say primary care, family medicine, pediatrics, and internal medicine. So, you have to understand, if you really want to be a family doctor, and you love the tenets, and you want to learn about osteopathic medicine, and you want to learn about how to treat the body, the mind, and the soul, and the spirit all together in one, and you love, the philosophy and the concepts of osteopathic medicine, you should definitely apply, because then you'll be able to, get into any of these specialties, because most family doctors are, coming from osteopathic school, comprised of almost 60%. Okay, but remember, you can become anything, any kind of doctor you want to be, and that's the other 40% that I listed at the beginning of our lecture today. And when you go to an IMG medical school, international medical graduate school in the overseas, remember that you just have to go through the pathway to take your USMLE step 1, step 2, and step 3, pass your CS when you come back to the US, and you want to do very, very well on this, so you're also competitive to be able to get into an allopathic residency. Remember, as an IMG, you cannot apply to a DO residency. You can only apply to an allopathic residency. So I hope I've been able to convince you, to give you options, to be able to know and have a little more knowledge about how to approach medical school. Well, I am the founder of Future Teaching Physician Lectures, known as ftplectures.com, where I teach nursing students, medical students, physician assistants, and help them succeed to do well when they take their exams, and to teach internal medicine concepts. And it's very important that you know that someday you're going to actually come back and watch some of my videos to be able to understand some of the clinical concept that's going to be taught to you in your medical schools. And I'm going to be there to be able to oversimplify these lectures for you. So always remember, subscribe to my channel, click the like button, and also subscribe to my channel up here so that I can keep making these more videos for educational purposes for all of the applicants out there coming today and in the future generation. Because you know what? You are going to be a physician. You're going to be the best doctor you possibly want to be. And don't ever let anybody rewrite your own history. Don't let anybody tell you can't do it. Remember, my people perish because of lack of knowledge. And now I have given you the knowledge. I have shown you the way. It's your choice to pick your own path. Pick it and be the best doctor you can ever be. Thank you very much for watching this video. It's Dr. Adeshina again from ftplectures.com. Please like my video and also subscribe to my channel. Thank you very much for watching. Bye-bye. Hey, thank you so much for watching the video. I hope you learned a lot. Are you studying for the USMLE Step 1 or Step 2? Are you studying for the NCLEX, or you're currently in nursing school as a nursing student? Are you a PA student currently in school or studying for your PANCE exam? Or are you a nurse practitioner student or trying to take your NP board exam? Listen, I've got super awesome content for you. If you truly love this video and it simplified your learning process, I want you to check out my website below. I've listed all the list of exams, whether you're studying for any of this board exam, and all I want you to do is click on the link right now below so that you can take you directly to my website. For USMLE, just go to smashusmle.com. For NCLEX, go to crushnclex.com. And if you're studying for the PANCE exam, the nurse practitioner exam, or you're studying for your internal medicine board exam, just click below and it'll take you directly to ftplectures.com. Listen, I can't wait to help you. If you need to get in touch with me, just get to my website, be able to reach me directly, and we can work together one-on-one. Listen, you're super awesome, and my goal here is to help your dream come true. If you want to be a doctor, want to be a nurse practitioner, a registered nurse, or physician assistant, I'm here to help you get to that next level. With your medical knowledge, let's save the world together. I love you guys. You guys are super awesome, and do not forget to click on the link below to be able to get to my website. Also, don't forget to subscribe to my channel. You guys have a great day. Let's go.